Hey everyone, this is Dr. Law. This week you'll be doing an assignment, I'm going to say discussion, on case conceptualization and on other aspects of case conceptualization. So I figured I would send you a video to give you some ideas. So case conceptualization is essentially an in-depth mental health assessment with the full biopsychosocial assessment aspect to it. What that means is you're going to, with a client, not only find out what brought them into your appointment, but also find out kind of who they are, what they're about. You really want to get a good snapshot of what's going on. So you can think of it as an assessment as a photograph of their functioning and who they are at that time when they come into your office. Now, this obviously implies that case conceptualizations can change over time, and that is normal. So it's hard to say how long one case conceptualization stays accurate. I would say about 6 months, depending on how well they're doing and how well their functioning is going. So as you work through the biopsychosocial assessment and you gather data on what is going on, their symptoms and the behaviors that are causing distress and impairment, um, not only do you want to find out what is going on that's causing them obviously issues for which they're coming to your office, but also you want to find out their strengths. You want to know what is going well. You want to know what they do in their life to get by and to make things, help them to get from moment to moment when things are difficult, because that is just normal. We all have difficult times and we all have coping strategies or activities we do that help us. So you want to know that, but also you want to know what isn't present. So in other words, let's say they're in there for depression and they're describing feeling unmotivated, sad most days, tired all the time. Maybe they've even had fleeting thoughts of dying, but not necessarily actively thinking of suicide. And that they're meeting kind of that criteria of a depressive disorder. That's helpful, but you also need to know what else is not there. So you need to find out about anxiety. You need to find out about mania, find out if there's been trauma or anything else. And so those are things you ask the client. And obviously, there's a lot more to it. I'm really taking a very big idea and shrinking it down just for this situation. But you want to not only, again, find out what is present that is causing distress and impairment, but also what is not present. That way you can figure things out through the process of elimination. Finally, once you've got your issues identified, let's say you've got a diagnosis and that it's a major depressive disorder, let's say it's a mild case, it's the first episode they've ever had, and there's no external issues going on, then you have to come up with a treatment plan. A treatment plan is the roadmap. And the roadmap literally has, just like any kind of journey, there are turns in it, there are road signs you watch for, all those kinds of things. So when you're coming up with a treatment plan, the first thing you want to do with the client is figure out how they want to be when they finish therapy. So you've already got the case conceptualization of how they are now. How do they want to be, 4 or 5 months down the line when they're finished up with you? That becomes the end goal. So let's say this client says, I just want to feel better. Well, that's great. So ask them what that would mean or what that would look like to just feel better and to be okay. Once you have that established, then you've got to figure out the steps. And the steps, again, are the different turns, the different parts of the road signs they need to watch for and that you watch for. Those are our objectives. So one objective might be to decrease depressive symptoms while increasing a sense of well-being. So that's objective number one. Then you have to decide how you're going to do it. Are you going to use cognitive behavioral therapy? Are you going to use person-centered therapy, play therapy, whatever it is, and you keep track of that. And the duration, how long you plan on doing it with that particular method, and how you're going to measure it. So let's say you just start out using a Beck depression inventory, and that you're going to give it to this client a month down the line and write it down. And so again, you've got your long-term goal, how they want to be when they are getting close to finishing, your objective, and there's more than one. I just gave one example. And those are the stepping stones to get to that final goal. The duration, and then the method. And so I hope this kind of gives you a little bit of a better idea. If not, then use this video thread or the thread below this video to ask any questions you have this week. Thanks.